Hello, I'm Dr. Emily Carter, a medical specialist in health, wellness, and natural medicine. Did you know that what many consider just part of aging might be silently destroying your brain? This is a question that needs to be asked because the truth is that many signs of Alzheimer's appear up to 15 years before the official diagnosis, during a period when interventions can still make all the difference. This is a topic that deeply concerns me as a physician because I see many patients arriving at my office when the disease is already at an advanced stage, when we could have identified and treated it much earlier. Today, I want to share information with you that could literally change the course of your life or someone you love. Shall we dive into this vital topic? If you're over 60 or care for someone in that age group, pay special attention when subtle behaviors begin to appear in daily life. The great trap of Alzheimer's is that memory loss, which everyone knows as the classic symptom, is neither the only nor the first sign. In fact, changes in mood and the ability to solve simple problems usually appear much earlier when there's still time to intervene effectively. To better understand what's happening, I need to briefly explain the process in the brain. It's a silent process that doesn't cause immediate pain or physical discomfort. Beta amyloid protein plaques begin to accumulate between neurons, while tangles of tau protein form inside them. This combination drastically interferes with communication between nerve cells, especially in the hippocampus and prefrontal cortex areas, which are precisely the regions responsible for memory and executive function. It's as if the brain's telephone lines begin to fail one by one until communication is completely compromised. Let me share a real case I recently followed. Mrs. Clarice, a 67-year-old patient, noticed something was wrong when she began having difficulty managing household bills. A retired teacher, she was always organized and methodical, one of those people you look at and think, how does she keep everything under control? She told me, Doctor, I began forgetting to pay some bills, something that never happened before. I also noticed I was getting anxious without reason and easily giving up on activities that used to bring me pleasure. After a complete neurological evaluation, we discovered she was showing the first signs of mild cognitive impairment, a phase that can precede Alzheimer's. Most importantly, we identified this in time to implement strategies that are maintaining her quality of life and independence. Now let's look at the 5 early signs that deserve your immediate attention. These are subtle signs that often go unnoticed or are erroneously attributed to the normal aging process. Pay close attention, because recognizing these signs can make all the difference. The first sign is alterations in financial judgment. Have you noticed increasing difficulty managing money, paying bills, or making simple calculations that were once routine? The person may begin making unusual impulsive purchases or become an easy victim of financial scams. This is a particularly important sign because our ability to handle finances involves complex cognitive functions that are affected in the early stages of the disease. When someone who was always careful with money begins showing carelessness or impulsivity, this deserves special attention. Have you noticed such changes in yourself or a close family member? The second sign is apathy and loss of initiative. We observe a gradual decrease in interest in hobbies and social activities that were once pleasurable. The person may spend more time in front of the TV or sleeping, without motivation to start projects or meet friends. It's different from temporary tiredness or a phase of introspection. It's a persistent and gradual change in motivation and pleasure in carrying out activities. That relative who loved gardening and now barely looks at the plants, or that friend who was the life of the party and now refuses all social invitations, these behaviors may be more than simple preference changes. The third sign involves spatial and temporal disorientation. Notice if there's difficulty finding familiar places or estimating how long it will take to perform everyday tasks. The person may get lost on familiar routes or lose track of how much time has passed. One of my patients who had been driving for over 40 years began getting confused on streets in his own neighborhood. Another warning sign is when someone starts missing appointments because they underestimate the time needed to prepare and get to the location. Have you ever had the feeling of being disoriented in places you should know well? The fourth sign involves changes in mood and personality. Observe unusual irritability, persistent anxiety, or depression without apparent cause. Some people become more suspicious or show inappropriate social behavior that completely contrasts with their previous personality. A gentle and polite gentleman who suddenly begins making rude comments, a calm lady who starts getting easily irritated with everyday situations. These changes aren't simply getting grumpy with age. They can be important signs of ongoing brain changes. The fifth sign is repetition of questions and stories. When someone repeatedly tells the same stories or asks the same questions in a short period of time without noticing the repetition, this goes beyond the occasional forgetfulness normal with age. It's important to differentiate. We all occasionally forget where we put our keys or the name of someone we haven't seen in a long time. The warning sign is when the person doesn't remember they already asked the same question a few minutes ago, or that they've already told the same story 3 times in the same day. Neurologist Dr. Marcelo Carvalho, a colleague I greatly respect, explains something fundamental about these signs. These symptoms appear well before the more severe memory lapses and are frequently confused with stress or depression. The earlier we identify them, the greater the chances for effective interventions. And he is absolutely right. Early diagnosis is the key to changing the course of the disease. Let me tell you another case that perfectly illustrates the importance of recognizing these initial signs. Mr. Carlos, a retired 64-year-old engineer, began showing unusual irritability and difficulty orienting himself while driving. The family noticed these changes but attributed them to the stress of recent retirement, thinking, "It's just a phase, he'll get used to it." Only 2 years later, when memory symptoms became more evident, did the family seek medical help. His wife shared with me a sentiment I frequently hear. If we had recognized the early signs, we could have started treatments that would significantly delay the progression of the disease. This is a regret you don't need to have in your family if you're attentive to the signs I'm sharing today. Now comes the part that most excites me as a physician. The good news is that early interventions can significantly delay the progression of Alzheimer. We're not talking about empty promises or miracle treatment, but strategies based on solid scientific evidence. Recent research published in respected journals, such as the Journal of Alzheimer's Disease and the New England Journal of Medicine, demonstrates that the combination of regular physical exercise, a Mediterranean diet rich in omega-3, constant cognitive training, rigorous blood pressure control, and frequent social interaction can reduce the risk of progression by up to 40%. Can you imagine the impact of this? These are additional years of independence, mental clarity, and quality of life. Neuropsychologist Dr. Amanda Silveira, a reference in the field, states something I always share with my patients. When we identify the first signs and implement lifestyle changes, many patients manage to maintain their independence and quality of life for many additional years. The brain has plasticity even at advanced ages and can create alternative routes to compensate for initial damage. This means that even when the process is already underway, our brain has an incredible capacity for adaptation if we give it the right tools. Perhaps you're wondering, but what exactly can I do if I identify these signs in myself or someone close? The first and most important step is to seek a complete neurological evaluation. Don't delay, don't minimize the symptoms, don't accept simplistic explanations like it's just age. Insist on a proper evaluation, preferably with a neurologist specialized in cognitive disorders. Early diagnosis can literally change the course of your story. After diagnosis, implementing an intervention protocol is fundamental. Let's talk about some strategies that have shown promising results. Regular physical activity, with at least 150 minutes weekly of moderate exercise, has a direct impact on brain health. Exercise increases blood flow to the brain and stimulates the production of growth factors that protect neurons. You don't need to become an Olympic athlete. Daily walks, swimming, dancing, any activity you enjoy and can maintain consistently already brings significant benefit. Diet also plays a crucial role. The Mediterranean diet, rich in vegetables, fruits, olive oil, fish, nuts, and low consumption of red meat, has been associated with a lower risk of cognitive decline. Omega-3 fatty acids, found mainly in fish such as salmon, sardines, and tuna, are particularly important for brain health. Have you already incorporated these foods into your dietary routine? Cognitive training is another fundamental pillar. Keep your brain active with activities that challenge it. Learning a new language, playing a musical instrument, doing crosswords or Sudoku, reading about diverse subjects. The important thing is to leave your mental comfort zone and stimulate different areas of the brain. Imagine your brain as a muscle that needs regular exercise to stay strong. Controlling vascular risk factors is equally important. Hypertension, diabetes, high cholesterol, and smoking are factors that accelerate cognitive decline. Keeping these factors under control is essential to protect brain health. Regular medical checkups and adherence to prescribed treatments are part of this prevention strategy. And we cannot forget the importance of social interaction and sleep quality. Social isolation is a significant risk factor for cognitive decline, while maintaining an active network of relationships protects the brain. Similarly, quality sleep is fundamental for the elimination of brain toxins, including beta-amyloid proteins that accumulate in Alzheimer's disease. Have you been paying attention to your sleep quality? Science shows us that the combination of these interventions has a synergistic effect, meaning the result is greater than the sum of the parts. Implementing all these strategies simultaneously can create a protective environment for the brain, even when the first signs of impairment are already present. It's important to highlight that, besides these lifestyle strategies, there are pharmacological treatments that can be prescribed by the doctor depending on the stage and specific characteristics of each case. Never start medications on your own, but also don't fail to discuss all available options with your doctor. For families dealing with a recent diagnosis, I want to emphasize the importance of emotional and practical support. Caring for someone with cognitive impairment can be challenging, and caregivers also need support. Look for support groups, learn about the disease, organize routines in a way that minimizes stress for both the patient and caregivers. Remember, knowledge is power, especially when dealing with complex conditions like Alzheimer's. Based on all recent studies, recognizing these early symptoms I've shared today can be the difference between years of accelerated decline or decades of active and independent living. If you or someone close shows 2 or more of these signs, don't wait for them to worsen. A complete neurological evaluation can completely change the course of the story. Don't let fear or denial delay an intervention that can be decisive for quality of life in the coming years. To conclude, I want to leave a message of hope and responsibility. Hope because science is advancing rapidly in this area, with new treatments and approaches being continuously developed. And responsibility because knowing the early signs puts us in a position to act before it's too late. Each of us has the power to protect our brain health and help those we love do the same. Remember, your brain is your most precious asset. Care for it with the same zeal you dedicate to the rest of your body. Observe the signs, seek early help, and implement the strategies I've shared today. Your cognitive future may depend on these actions. I hope this video has been enlightening and useful for you. If you liked the information, don't forget to leave your like, share it with those who might benefit from this knowledge, and subscribe to the channel for more content on health and wellness. In the comments, tell me if you've already noticed any of these signs in yourself or someone close, or if you have questions I can clarify in upcoming videos. Stay with us, because in the next video, we'll reveal the 7 daily habits that can reduce the risk of developing Alzheimer's by up to 53%, even if you have a genetic predisposition to the disease. It's content that can literally transform your brain health. Until then, take good care of yourself. This is Dr. Emily Carter, always by your side on the journey to comprehensive health.